Welcome everyone to the Bees Knees workshop. I will be your host for this evening. My name is Paiten Brand. I'm a registered physical therapist at Easthill Physio, and I'm so excited that you are joining me tonight to learn all about your knees. So, a little bit of housekeeping before we get started here. I'll have everyone please turn off your microphones or mute yourself. The button should turn a red color when you're muted. Please don't click the Present Now button or everyone will see your screen. And we will be using the chat function throughout our presentation tonight. So when you're ready to send a chat message, click on the little chat box in the lower right-hand corner, and you can type your message and everyone will be able to see that there. Awesome. So let's try out that chat box here. Everyone that's attending tonight will be entered for some free Easthill Physio sessions. If you are interested in winning, let's type in the chat win. If you're interested in some free Easthill Physio. So try out that chat box and make sure that you know how that works. Awesome. Who doesn't want free physio? Absolutely. Awesome, you guys. Okay. So let's get a little bit more practice with our chat box here. Biggest and possibly the most important question of the night. Do bees have knees? What do you think? Yes? No? Not sure? Maybe? Type in the chat box. Bees? Knees? Sure, I like it, yeah. Some yes, some maybe. Ooh, a couple no's? Okay, big reveal. Yes. Bees have knees. They have 6 of them. So you guys can rest easy tonight knowing that bees have knees. Awesome. So we'll come back to our chat in a minute here. A little bit of what we're going to be covering tonight. We'll talk a little bit about some basic knee anatomy, some of the most common causes of knee pain that we see, some common myths surrounding knee pain, what alignment of your knees is and how to go about creating it, and some exercises to help keep your knees healthy. So let's talk a little bit about what brings you guys here and what's going on with your knees. So we're going to start a poll. So to access the poll, you're going to go to the little triangle shaped symbol. And let me just fire up the poll here. So you guys should be able to access the poll, and it should say, what does your knee impairment limit you from doing? And we've got some options there: walking, stairs, running, hiking, or sports or other activities. See if you guys can put some votes into that poll if you can find it. Awesome. Some running and hiking, some sports and other activities. Okay. All right, and again, that little poll is in the bottom corner. It's a triangle, square, circle. See if you guys can find that. Okay, so seeing lots of running, hiking, lots of sports and other activities, a couple stairs, absolutely. We see a lot of that stuff in clinic, very common complaints. So we're gonna close this poll and I'm gonna launch our second one here. When does your knee pain affect you the most? So looking at your day, when are you feeling your knee the most? You feeling it in the morning, towards the end of your day, when you're doing physical activity, or when you're done physical activity? Take a vote in that poll and see what everyone else kind of feels as well. Okay. So lots of different ones here. Lots during physical activity, absolutely. Some after, a little bit in the morning. Okay. And depending on when you're feeling that pain, it kind of tells us a little bit about what's going on in your knees. So that's really helpful information. Okay. It looks like during physical activity and after physical activity are the biggest ones, which is good. That's something that we're going to talk about a lot throughout today. Okay. And last poll for right here. Let me launch that. Where is the location of your knee pain? In your knee, do you feel it more on the front where your kneecap is? Inner knee, outside of your knee, behind the knee? Whereabouts do you feel it? Ooh, lots of inner knee, some kneecap. And again, just kind of tells us a little bit more about what's going on in your knee. Okay. Lots for inner knee and front of knee. Those look like they're the biggest winners for right now. And that's something, when we talk a little bit more about our common causes of knee pain, we'll talk about what is kind of causing in those different locations. Okay, yeah, it looks like inner knee is kind of the winner there. Okay, so I'm just going to end this poll here. Thanks for your participation with that, everyone. So we are going to do back to our chat box here so you guys can type up. If you didn't have any issues or any pain with your knees, what would you be doing? Or in other words, what is your knee pain limiting you from doing? So this can be something kind of straightforward like walking. It can be more active. Yeah, some walking and some hiking. Gardening, yeah, absolutely. We've got spring here, so absolutely lots of those activities. Yeah, yoga involves a lot of mobility through the knees. Those are awesome. And so I love asking this question because once you start working towards a goal, it just makes it matter so much more. So it's awesome to have that in mind. Yeah, lots of sports, golf, squatting. Awesome. Okay, thanks so much, guys. We're going to move on here, and hopefully we can come back to see how those goals might come back into play for you. So our first stop on our roadmap today, we're going to talk about some knee anatomy. So we are going to look at some important anatomy around the knee, and I've got a little model here if you're looking at my screen, or you can follow along with the slide. So first, we're going to talk about the joints of your knee. A joint is a connection between two bones, and the knee actually has two joints. So the first one is where the thigh bone or your femur meets the shin bone or your tibia. So that main joint across there is your tibiofemoral joint. And then our second joint in the knee is actually between the kneecap or patella and where it sits on the thigh bone or that femur. And that joint is called your patellofemoral joint. So those two joints make up our knee. And then we've got ligaments within the knee. 4 ligaments. We've got one on the inner part of the knee, your medial collateral ligament. And on the outside of the knee, you've got your lateral collateral ligament, offering support inner and outer knee. And then deep inside the knee, underneath all of that, we've got 2 ligaments that crisscross in the knee. And those are your anterior cruciate ligaments and posterior cruciate ligament. So MCL, LCL, and then deeper in the knee, PCL and ACL. The function of our ligaments is to help provide stability to the joints. And depending on where they are in the knee, they resist different forces and help stabilize. And then also within that knee joint, we have the meniscus. So this thick layer of blue in here, underneath there, thick layer of blue in there is your meniscus. And that is a tough piece of cartilage that helps stabilize the knee even further and helps absorb shock. And then on top of all of that stuff, we have a ton of muscles. So we're not going to go into specifics because there's a ton around there. But looking at that picture, you can see the big muscles of the front thigh, your quad muscles. We've got the back of the leg, your hamstrings, and the calf muscles also cross the knee. So all of them really, really important as we kind of delve into more about that knee. So those are your basic anatomy coverings of the knee, and we'll come back to some of those spots as we talk a little bit further. So moving on in our roadmap, we're going to talk about the most common causes of knee pain and what we typically and often see in physio. So first up, we're going to come back to those ligaments. So like we chatted about, MCL, LCL, deep within the knee, ACL and PCL. Those ligaments, When they're injured, often it involves a traumatic incident. So for example, it can be a weird fall when you're skiing, an awkward tackle or a hit in a sport, or a bad plant and twist when you're walking. All of those ligaments function to support the knee in a different way and resist different forces. So they're injured in different ways. So when we look back at our MCL on the inside of the knee, it's injured if there's a force to the outside of the knee that pushes on that ligament. And then the LCL is the opposite. Outside of the knee, a force from the inside will stretch out that ligament. And then the inner ones, the ACL, that can be injured from weird or different movements while you're pivoting, decelerating, jumping, or if you overbend or over straighten the knee. And then lastly, the PCL, that other ligament within the knee, it can be injured by forced overbending or forced over straightening. And it's also termed the dashboard injury, as it can be injured if you've got your feet resting on the dashboard when you're the passenger in a vehicle and you get into an accident. So if you are one of those people that like to rest your feet on the dash when you're a passenger, I and all other physios out there ask you to not do that, please, for the sake of your PCL. So for injury to any of those ligaments, usually the initial incident is super painful. You can feel or hear a pop sensation often. Usually it's followed by a loss of range of motion, and there can be a lot of swelling and feeling of instability as well. So that covers our ligament sprains and tears. Next up, let's chat about the meniscus. So that cartilage, thick cartilage in between that tibiofemoral joint. An injury to your meniscus can happen with a forceful twist, especially when your joint is loaded. So example, a plant and twist in soccer, or just while walking or dancing. Often at the time of injury for the meniscus, there's a lot of swelling, reduced range of motion, and you can also experience locking or catching of the knee, where your knee will get stuck in a certain position and it's really, really painful to release. Often the meniscus isn't injured in isolation. So what that means is often other things around it are also injured when it gets hurt. So sometimes you can have the meniscus, MCL, and the ACL kind of all together. They can happen one by each other or often together as well. And so while ligament and meniscus injuries are more common following an injury or a specific incident, these two here are usually developing with time and not related to one specific injury. So first on this slide here, patellofemoral pain syndrome, or PFPS, because that is a mouthful. It is pain at the front or inside of the kneecap, and usually it develops over time due to poor alignment, which we will chat lots about what that alignment is. So when we look back at our knee here, the kneecap or patella bone has a very specific groove that it needs to sit in on the femur bone. And if it's not sitting directly in that groove, or if it's pulled to the side and you bend and straighten while it's not in there, it can cause a lot of pain and discomfort. So as we saw with those muscles, we've got a ton that attaches in and around all of that area. So you have to think that we have to be really balanced everywhere for that kneecap to sit in its nice little happy groove. So it's a really common one because it is pretty easy to have imbalance. Usually what we see in clinic is that muscles on the outside of the thigh, the outer quad, are really tight, and the muscles on the inner quad and hip aren't as strong, and that balance causes that kneecap not to be quite in its happy little groove. Usually, patellofemoral pain syndrome involves pain with repetitive bending of the knee, so thinking running, squatting, stairs, and it can give you a lot of grief and soreness if you're sitting for a while and then you go to stand up. And that's all due to that imbalance around the knee. And then lastly, for our common causes of pain in the knee, we're going to chat about osteoarthritis, or OA. So OA is the result of normal daily wear and tear and normal use of our joints. It involves narrowing of the cartilage of the knee, and it can lead to decreased shock absorption and lubrication of that joint. Some risk factors for developing osteoarthritis include being overweight, muscle weakness and imbalance, repetitive joint loading, especially over a long period of time, like with an occupation, or being inactive or sedentary. The development of osteoarthritis can be accelerated following a major injury, like a ligament tear or meniscus injury, but it can also happen if you don't have any of those injuries as well. And I always think that osteoarthritis or any type of arthritis sounds really scary, but keep in your mind that a lot of it is normal daily wear and tear, and it doesn't need to be scary. And there's so much that we can do to help prevent it from affecting your daily life. So we've talked about our most common causes of knee pain that we see: ligament and meniscus injuries, and then our over time developing patellofemoral pain and osteoarthritis. So if any of these things sound like something that you might be experiencing or someone that you know might be experiencing, what is some good news? Physio can help. So all of these things are everything that we see in clinic when someone comes in with a painful knee. So it's really common. There's lots of people out there that are experiencing similar things. And of course, aside from these common causes, there's lots of other things, or sometimes it's a combination of things that can cause your pain. But a physio can help assess, see what the issue is, and recommend a treatment plan to help getting you back to doing the things that you love. So what is next on our roadmap here? We've talked about some anatomy, some of those common causes of knee pain, and we're going to do some myth or fact. So I'm going to have you guys reopen your chat boxes, and I will have you typing in myth or fact to our next couple questions here. So type in the chat box, myth or fact. You should avoid physical activity if you have knee pain. What do you think? Should we be avoiding physical activity? Ooh, lots of myths. Okay. Okay. I am loving that answer. Ooh, depends. Okay. So, myth or fact, should we be avoiding physical activity if you have pain? Myth, you guys are awesome. Okay. So all of our joints benefit significantly from activity. Movement helps increase blood flow, which has healing properties in it, and it helps with the natural lubrication of joints. I love the saying, motion is lotion. The more you move, the more your joints get lubricated and primed for more movement. So sometimes it's hard to start, but once it's moving, it's easier to keep moving. If you have pain with activity or certain exercises, this doesn't mean that you should be pushing through it, but that we should be finding activities that are manageable, and then we can work towards those other desired activities. So awesome job on that, guys. Next, myth or fact. Torn ligaments, like the ACL that we talked about, need to be surgically repaired. What do you think? Myth or fact? Ooh, lots of myths so far. A couple yes, a couple not sure, a couple fact, okay. Ooh, a little bit more uncertain here, some depends. Okay, so myth or fact, torn ligaments need to be surgically repaired. This is another myth. Many people with full ligament tears can recover phenomenally with a conservative physio approach that includes activity modification, progressive range of motion, and strengthening. Oh yes, in the chat, you guys are awesome. You're crushing it. So I've got an awesome example of this that you guys might remember. from the news just not too long ago. In 2019, Connor McDavid, he had, from this injury that you can see in the video, McDavid suffered a complete tear of his PCL, tears to his meniscus, a complete tear of one of the muscles around his knee, and a fracture to his upper shin bone. After all of this, McDavid was offered and recommended surgery, but he opted for intensive physio treatment, and he was back on the ice following a full recovery in about 6 months. And I might be a huge Maple Leafs fan. I know, but I can appreciate this recovery. So yeah, this is not true in every case that you need to be strictly repaired. And while some people, that is a good option, it's definitely not always the case. So next myth or fact, if you guys still want to listen knowing that I'm a Leafs fan. Noise in the knees means arthritis. What do you guys think? Myth or fact? Oh yeah, some go Leafs, nice. Ooh, some maybe, some myth, some fact. Okay, so myth or fact, noise means arthritis. Myth, noise from the knee joints and most of our joints generally is not a problem. A lot of different things can cause noise in the joints and in the knees. If the noises are pain-free, they're usually not a concern at all. Some of the things that can cause noise around the knees includes tendons moving around different structures and gas bubbles popping, which is exactly what happens if you crack your knuckles. That's just gas bubbles popping. So that's totally okay, totally safe. So while most of that noise, totally fine, especially if it's not painful, some noises can be indicative of joint wear and tear or other injuries. So if the noises are painful, it's a good idea to double check just to see if it is contributing to something going on there. So overall, no, every noise does not mean arthritis, but if it's painful, it might mean that something's going on. Okay, so awesome job on the myth or fact with that, guys. Thank you so much for your participation. We're going to move on to chat about alignment. So we hear a lot when you're doing exercises and all of that sort of stuff to have proper alignment. What the heck does that actually mean? And how do we get it? So when we're talking about knee alignment, we're looking at the position of the knee relative to the hip and ankle. And so looking at that picture on the left, we want to see that nice straight line, hip, knee, ankle. And then we can have variations where we're out or in, like those pictures show. And some things that can influence that is genetics and bone structure, which we can't necessarily change, and mobility and strength at the hip and ankle, which is something that we can absolutely change. So often when we see issues arising from alignment, we see issues from the knock knee on the right-hand side or a knee valgus position. One of the most common and important muscles that controls this actually sits up in your hip. So we're going to talk about that because I don't think it makes sense when you just say that a muscle in your hip controls all of that alignment at your knee. So the glute med muscle or gluteus medius, because of how it attaches, has a huge role on what your knee is doing. So I'm going to stand up here and show you guys kind of what I mean with that. So that muscle, gluteus medius, on the side of your hip, if it's not strong enough and not doing its job, it allows the knee to drift in across the body. If it's strong, it helps pull you nice and straight. So all of that coming from here, but that's a huge impact on that knee position. So as we get into some strengthening, that's a really, really important area of strengthening. But I want to do a little bit more seeing what alignment means in more dynamic positions. I think it's easy enough to kind of see when you're standing looking straight, but what does it look like in real life activities? So I will invite you guys to join me and try some of these if you feel safe and comfortable to do so, if you'd like. If not, you can just kind of watch. I want to show you what proper alignment looks like for some dynamic movements. So first up, we're going to do a squat. So as you guys can see in the picture, we want a nice line over knees, toes, and hips. So that is nice. Knees are happy. All my other joints are really happy. If that muscle in my hip isn't doing its job, that allows that knee to drift in, and that can put a lot of pressure on that joint. So while you might not be out doing a bunch of actual squats, we need that movement to pick something up off the ground or to get up out of a chair. So it's a really, really important move. And if you guys want to try this, stand up and try a squat and see what your knees are doing. Do they cave in at all? Does one cave in? See what you feel. The next one I'm going to try, a little bit more advanced, is a small single leg squat. So same thing, but now we've got all of that body's pressure here. Good alignment. We're looking at nice straight line down all the way. If that muscle in our hip isn't doing its job, it allows that knee to come across the body, just like that. And again, while you might not be doing a bunch of single leg squats, we need that single leg support and stability while we're walking and running. So it's really, really functional. And then the last one here is a step up or stairs. So as we're coming upstairs, good proper alignment, knees driving forward all the way up. And same thing as the leg that you're lowering on. Nice straight line. If those muscles aren't doing their job, we might see as we step up, that knee cave in across the body. And same thing as our lowering leg. We might see that knee come in across. And all of those movements are just a lot more pressure on all of those structures that we've talked about. So if you guys tried any of those or just kind of watching, type in the chat box. Do you think that alignment might be the cause of any of the issues or pain that you're feeling? What do you think? Type in that chat. Possibly, yeah. And I would say if you aren't doing some strengthening around your hips, there's a chance that it might. Absolutely. Okay. So once we get to our exercises and go over that, there's going to be lots around the hip. So anyone who kind of answered yes to that, those will be awesome for you to give it a try too. Okay. So we've covered some alignment. Last stop, we're going to talk about that strength. So for our exercises, before we get too far into it, a little disclaimer is that while most of these exercises are helpful for anyone that's experiencing pain in their knees, and it can help prevent pain, there shouldn't be more than a 1 or 2 out of 10 discomfort while you're doing these. If there's more than a 1 or 2 out of 10 pain, this probably isn't the best exercise to do right now, and we should probably find something that is better adjusted for your body. So I've got a couple different categories of exercises. I'll be showing one from each, and then you'll get a handout in the email that you get following the workshop in the next couple days that has all of the other ones. So from our first category here, mobility and stretching, keeping things limber and mobile. I'm going to go over the heel slide. So I'm going to show you on the bed here, heel slide in that top corner. And this exercise you can do on the ground. You can do it on the bed. You can do it on the couch. It does not matter. The picture will show with a belt, but you can do it actively as well. Very simply sliding up and down. And if that doesn't feel awesome, we can add a little bit of help with the arm. So this exercise is absolutely amazing because it gets that joint moving. It helps with the lubrication of the joint, and it comes back to that motion is lotion idea. So it's fantastic. If you're sitting for a while, have a couple heel slides before you start moving, and that should prime you for movement. So that's an awesome one for mobility and stretching. Also in that category, we got some foam rolling and stretching. That will be in your handout. Okay, let's talk about glute strengthening. So a good one, and on the simpler side from the options here, is a clamshell. So I'll show that one, and I'm going to show it without the band, but you've got the banded option if you want to. So again, on the ground or on your bed, lying on the side, you can lie all the way down. You're going to keep your hips stacked as if there's a straight line through them, and knees and toes together. And then you're lifting and lowering only to the part where your hips would start to roll back to help you. So it's not a big movement before my hips would start to roll. So that's all I move within. This exercise here is targeting that glute med muscle that supports and helps prevent that knee caving in position. So it's an awesome one, and you get to lay down while you're doing it, which is fun. So that is a great one, and if it feels easy enough, then we can add a band or progress to some of the other ones on there. So next up, knee strength. I'm going to show you the quad setting exercise here, but there's a couple other ones. The quad set exercise helps engage all of the quad muscles in a nice, safe, controlled way. So tucking a towel or a pillow underneath your knee, lying down or sitting up, keeping your heel where it is, all we're going to do is squish that pillow using all your quad muscles, holding for a count of 5, and then relaxing. So a nice strong squish, hold, and relax. Engaging all of the quad muscles, and this one keeps that kneecap really, really happy in its little groove. So it's a good one for all of that alignment stuff as well. Okay. And then last up for our exercise categories, alignment, control, and strength. So like we talked about, being aware of that knee position is very, very important. These exercises are challenging, and these ones really, really matter to do them correctly and pay attention to your form. So keeping in mind what we've talked about for alignment, hip, knee, toe position. I'll show you the lunge, and then we've got our other options there. So looking at our lunge. Feet set up. We want to think feet on railroad tracks, not a tightrope. So a nice wide base. And then knee position. As we go down, nice straight lines for both of our knees, sinking towards the ground, not driving forwards. And I'll do a little bit of a side profile here as well. So you're more down than you are forwards. So sinking down and coming up, really being mindful that that especially front knee doesn't want to cave in on you. Lunge is an awesome exercise for so many muscles around the leg and really challenges that alignment. So it's an awesome one. Okay, so a couple exercises to work on, and you'll get the handouts and everything. A couple tips for those exercises. Like I said, there should be no more than a 2 out of 10 pain while you're exercising with those. And if there's more than that, we should probably find an alternative exercise that's a bit more comfortable for you. Strength exercises, 3 sets of 8 every day or every other day is amazing. Mobility exercises like our heel slide, 2 sets of 10 a couple times a day, fantastic. And stretching, 3 holds of 30 seconds is our goal. And then a couple extra miscellaneous tidbits that I tell everyone for happy knees. Avoid sitting with your knees in a stationary position for too long. If you work at a desk or if you stand a lot, try to get some movement. Think motion is lotion. Try a couple of those heel slides, get some movement in there. If you're a side sleeper, tuck a pillow between your knees. We're in bed for a long time, so thinking about bed knee alignment, nice straight lines while you're sleeping there too. If you do a lot of standing, try to have equal weight on both legs, not just standing off to one leg or the other. And avoid standing with your knees overextended, so extra straight. And then once you feel better, after you do your exercises and you need to be, don't just stop doing your exercises cold turkey. Do a slow weaning off so you can find where that maintenance level is to keep everything nice and happy. And then lastly, everyone always asks heat or ice. So my general rule, if it's within the first little bit of a new injury, if it feels hot, if it feels swollen, or if your pain is above a 5 out of 10, ice is usually a really good call. And then if you haven't just had the injury, if it's not swollen and not hot, less than a 5, heat is amazing. Usually it feels great if you've got a muscle or a joint is stiff and sore. So we have talked about a lot today, a lot of information. We've talked about some basic knee anatomy, some common causes of knee pain, some common myths surrounding knee pain, alignment, how to create it, and some exercises to keep your knees happy and healthy. So type in the chat box, what is your biggest takeaway from today? Is there anything that you learned, anything that you might do differently or add into your routine? And it can even be that you learned that bees definitely do have knees. Question here. How do I position myself as a back sleeper? On your back, generally, we're not as concerned about that knee together position. So the knees are generally a bit happier there. So some people like a little tiny pillow behind the knees. That or flat is awesome. Okay, knees connection to hips, exercises, keep moving, motion is lotion. Yeah, do you think I said that enough times today? Okay, awesome. I think that those are great takeaways today. Keep things moving, some exercises, and you guys will get the handout that's got lots more of those exercises to try. Continuing the exercises, absolutely. Okay, awesome guys, thank you for that. So we will answer any burning questions in a minute, but if you feel that you've got a question that's really specific to you and you want me to personally follow up with you, type knee in the chat box and I will follow up with you with a phone call and we can chat about what's going on and we can see if physio is appropriate for you if you're not sure. So if you'd like me to follow up, type knee in the chat box. If you've heard enough today and you think that physio might be helpful for you, you can take a look online or give us a call if you're interested in coming in. And then over the next couple of days, I'll just have you guys watch your emails and you will get a couple of things. You will get the link to the recording of today's workshop in case you missed anything. You will get the exercise PDF with the ones that we covered and the other ones, and the post-workshop survey. And that helps us improve and make our workshops better for the future. And then speaking of future, we have Restore Your Core coming up in May. Okay, so Any burning questions at all? Awesome. Thank you guys so much for attending. If anyone has any questions, please type it in. And if not, thank you guys so much for hanging out with me this Wednesday. Ooh, where should you put a TENS? And Deb, I'm guessing you mean the little TENS machine. Usually they like to have one pad on either side of your pain. So if it's right within the knee, thinking about outside of that pain, or if you've got the 4 pads on all corners kind of surrounding that pain. Good question. Yeah. Awesome. Thanks so much for tuning in, guys. Does taping help? Yeah, I think taping can be a super helpful tool. It doesn't take away usually what's going on. I like to use it as a bit of feedback for yourself. So K-tape, KT tape, kinesio tape, all of that stuff. I like to use it as feedback for your body to do more rather than just passively support your body. And in that case, I think that it's super helpful. It just tells your brain what your body wants to do a little bit easier. So absolutely. Okay. Does being overweight cause patellofemoral pain syndrome? So not necessarily. It's more that imbalance. That might be a factor that contributes, but absolutely not all of the time. It's more that imbalance of tightness in areas and weakness in other areas. So lots of hip strength, and that will be absolutely happy. Okay, what do we got here? Hannah, how does a complete torn ligament in the knee reform if it's not contractile? Good question. So very interesting and maybe a bit too deep for right now, but generally when we say a recovery from a torn ligament isn't meaning that the ligament is re-healing itself, but that you can function 100% without it because everything else can take over in such a good way. So that is normally the answer. Extra interestingly, if anyone cares, they have some really cool new research, like really recent research, showing that ligament full tears from years ago have shown on MRI that they can completely heal. They don't completely know the science behind it, why, who it happens in, and all that sort of stuff, but they know that it's out there, and that's actually super recent stuff. So generally, it's just that everything else is helping. Okay. Exercises for stiff knees. That heel slide that we did, I love that one. Motion is lotion. It's a great place to start, as well as that little quad set. Those are safe, and there's lots of other ones that we can do that can be more specific to what you've going on. Who is that? Heidi. So lots that we can make really particular to what you've got, but I would say that heel slide and the quad set would be awesome places to start. And Crystal, pills good. So totally depends. It depends. If it helps you exercise and get to your goals of activity in an easier way, then I think that there's a use for it. We certainly don't want to mask and cover up that healthy protective pain, but I do think that there's a function if pain is absolutely a barrier to your activity. So sometimes, yes, but we don't want to rely or cover up that good pain as well. Okay. Ooh, motivation to keep up the exercises when pain is no longer reminding you. That's a tough one. It's a really tough one. I like to think back to that why, that question that we asked at the start. What would you be doing if you didn't have knee pain? Think about that. That's what you've put all your hard work into. And if you keep coming back to that, I love to use that as the motivation to keep pushing and keep doing what that Y factor is for you. Okay. After ACL surgery, is it possible to get back to 100% function? Yes. Everyone will have a vastly different reaction. It depends on what your initial injury was. It really depends on what you're going through, what your surgery was, and all those other factors. But absolutely, it is possible as long as we're doing appropriate activity modification, appropriate loading, and then all of that preventative, protective strengthening. Absolutely. Carol, are knee supports, flexible knee supports helpful? Again, kind of similar to taping. I think that there is use for it. I like it if you're really unsure and not confident in an activity, and if it makes you feel a little bit better. Absolutely. I think that there's a function for it. We don't want to rely on it, but if it's feedback for your body and it helps you be more active, totally. Yeah. Jan, does a Baker's cyst ever go away? Well, that's a good question. For those of you who might not know, a Baker's cyst sits behind the knee, and it's just an area that can fill with fluid and be kind of irritable. So yes and no, this is another, it depends. Sometimes, depending on what you've got going on and what caused it, they can be a bit stubborn and stick around. And usually those are ones that tend to fluctuate sometimes. They can be irritable. They can go away, but they're a little bit more unpredictable and irritable. Yeah. Okay. Walking, running, orthotics effects on knees. Yes, absolutely. So in our alignment, I really talked mostly about the hip and that glute-med muscle, but absolutely the foot and ankle, that's its counterpart. So if you've got good support at the foot with either muscle support or external support from orthotics, it does kind of the same effect as that glute-med. So that's a great point. That's another area that we always need to be mindful of, and it can hugely impact and affect that knee for sure. Okay. Lana, do we have any recommendations for natural herbs or supplements to help solve knee pain? Good question. I don't have anything that I typically recommend, and technically out of my scope of practice, but I know a lot of people that I see take or find relief with magnesium and certain things like that. But I can definitely look into that one and get back to you. I know that's a common one that I hear though. Okay, and do compression sleeves help? Good question, Deb. Depends on what you've got going on. If you're dealing with swelling, compression can be helpful for that. Compression sometimes feels nice and supportive to a joint, which again, for confidence, if it helps you be more active, that's a great thing. Yeah. Not solving much of that underlying issue, but if it helps you be more active, I think that's always a win. Okay, and Carol, is acupuncture helpful to relieve pain? It absolutely can be. Lots of different types of needling. We've got acupuncture, dry needling, IMS, all of those things. They kind of function with different methodologies, and I think all have a time and a place and can be really, really helpful to relieve pain, help you get more movement and get back to your activities. Absolutely. Oh, those are awesome questions, guys. Anything else that you guys can think of, or anything that I missed? Does glute min and max weakness affect knee alignment? Yeah, really good question. Glute min sits right underneath glute med, and it does the same movement and control at the hip. It's just a smaller muscle. So definitely glute min. When you're strengthening glute med, you will also strengthen that glute min. And glute max weakness will less directly affect, but still very, very helpful. It's not as stark a difference for that valgus or knee knock position control, but generally supporting the hip has a lot of an impact. on the knee. Absolutely. Yeah, really good question. And anything else you guys are wondering about? Those were great. And if there's no other questions, thank you guys so much for sticking with me today and all of the involvement. That was amazing. And then just remember to keep an eye on your emails for all of those stuff that'll be coming over the next couple of days. Okay. Awesome. Thank you so much, guys, for tuning in tonight. Awesome. Everyone have a great night as well. You guys feel free to sign out, and I can follow up with anyone if they have any questions too. Thank you, guys. Ooh, why is squatting an issue? Could you be a little bit more specific? Ooh, okay, only can squat if leaning on something to take off the weight. So, I'm not 100% sure. Correct me if I'm not understanding your question 100%. Squatting an issue, you can only squat if leaning on something to take off the weight. That sounds like it could be an alignment type thing, or it could be a combination of some of that other stuff. A stiff and angry joint sometimes doesn't love the loading of a squat initially. And it definitely could be an alignment thing as well, but kind of finding out which is which would probably help you get back to that squat for sure. All right. Awesome. Thanks so much again, guys, for joining in tonight. Yeah, hopefully see you guys in some future workshops. Have a great rest of your night.